Thank you, everyone, for joining us today. We are here with Minister Adrian Dix. We're going to go to our first question. Vinder Sajan, CTV.
Hi, Minister. Just wanted to ask you about the B1617 variant from India. I understand BC has detected dozens of this variant of interest, and I'm wondering, is this now beginning to trend more towards a variant of concern given the rate of transmission in India, and is this something you've raised with the federal government?
The B1617 variant has not been identified yet as a variant of concern. That said, all COVID-19, all cases of COVID-19 are of concern. They are in India and they are in Canada. We do have some concerns with the implementation of the federal quarantine. We think that more can be done with respect to ensuring that people are not just, that the quarantine is not only enforced, but people are supported in what can be a very challenging quarantine. So we are, of course, asking the federal government to continue to do everything they can to ensure that British Columbians are protected and to fully enforce the federal quarantine as people come to this country on international travel. So we regularly communicate this to the federal government. The Premier meets with the Prime Minister and other premiers regularly, and we'll certainly be making this point to the Prime Minister as we work, all of us together, to reduce the transmission of COVID-19 in British Columbia. But yes, this variant is, if it's not a variant of concern, and it hasn't been identified as such yet, it's concerning, as are all cases of COVID-19 in BC.
Vinder, do you have a follow-up?
I do. This is for my colleague. She says the scientific community seems to have consensus that airborne COVID transmission is a significant source of infection. The WHO has updated its description to include both droplets and aerosol transmission, yet the BC CDC only talks about droplets. Vancouver Coastal Health website says there is no evidence of airborne transmission. Will you be updating public health messaging to acknowledge and emphasize COVID is airborne?
Well, I think public health messaging is clear in British Columbia. Right now, we need everyone to be part of the reduction of COVID-19 transmission in our province. The BC CDC has been, I think, a national leader and a world leader in addressing issues of COVID-19. And we've seen this consistently over time. And the direction is clear. Only socialize with those in your household. Assiduously follow workplace safety plans. And you see that where there is in workplaces, other than those that have been deemed essential, where there is workplace transmission, there have been, in the month of April, more than 100 workplaces closed. That all of us need to wash our hands and practice physical distancing and wear masks, especially in indoor public, in a mandatory way, in indoor public places. So this advice is built on a year's experience with COVID-19 and a lifetime's experience of dealing with viruses at the BC CDC. And you can expect the BC CDC to continue to lead in British Columbia with providing information to the public as they have from the beginning of the pandemic.
Next, we go to Keith Baldry, Global News. Keith?
Hi, Minister. I wondered if you could comment. We now have our first case of someone in their 20s dying of COVID-19, which of course follows on the heels of the tragic death of someone under the age of 2. But someone in their 20s dying of this, should that send a signal to some of the people we've now seen in those infamous videos on the weekend of gathering in large numbers in that age cohort?
What it tells us is that COVID-19 is a vicious virus. It's vicious to everybody and can be vicious to everybody of any age. Of course, it causes the worst outcomes for our elders and for those who are clinically vulnerable. And that's why we focused our immunization campaign on those groups and spent enormous efforts as a community to protect those groups. But whether you're in your 20s or you're younger or your 30s or your 40s, COVID-19 can be vicious. We've seen this in this case, which I think came out in the weekly summaries, the statistic that you're talking about of the person passing away. This case as in all cases of young people who pass away, is particularly tragic. And while I can't speak of the details of the case, I can say that everybody, especially everybody who's clinically vulnerable and everyone who gets an opportunity to get vaccinated, when your turn comes, get vaccinated with the vaccine that you're offered. And for all of us, we have to remind ourselves of the absolute essential importance right now of following public health rules and public health guidance for our own sake, for our own health, whether we're in our 20s or our 70s, and for the sake of our families, of our parents, of our grandparents, of our children, of our friends, of our community, that this is absolutely demonstrates the need to follow those public health orders and public health guidance, particularly now in this period as vaccinations ramp up and increase. Today, 31.8% of eligible British Columbians have received their first dose, by yesterday I should say, of COVID-19, 31.8%. As that continues to happen, this is the time to pay particular attention, because as we move towards vaccinating a majority of British Columbians by the end of May, this is not the time to come down with this vicious virus.
Keith, did you have a follow-up?
Yes, back to your mentioning of the workplace closures. You said more than 100. Just could you put that in context? Is that a lot? Does that show that the health order is working, allowing WorkSafe BC to shut these down, or is it also showing that people continue to come to work sick?
Well, what it shows, these are cases of, as per the order by the provincial health officer, and these are all decisions by medical health officers of health authorities, which are supported and in many cases put in place by WorkSafe BC. And the purpose of it is to support businesses where transmission has occurred, so that A, they can get back to business as soon as possible. In a number of cases, we can vaccinate workers to try and stop the spread in a number of those cases. But yes, there are a significant number of businesses that have been closed. The majority of that, more than 80, are in the Fraser Health Authority. A significant number are in the Vancouver Coastal Health Authority, and a handful are in all the other health authorities combined. In Interior Health, I think it's 3 or 4. On Vancouver Island, I think it's 1 or 2. And so what that tells us is that we are determined to support businesses in ensuring that COVID safety plans keep workers safe. And in particular, we're going to intervene, working with business, working with WorkSafe, working with provincial health to keep workers safe and to keep businesses safe.
Thank you. For the next question, we're going to go to Lisa Yuzda, News 1130. Lisa?
Hi, Minister. Speaking about AstraZeneca, there's a lot of confusion with people trying to book who are 40 this year. Some people being allowed to book if they turn 40 later this year but aren't 40 yet, others being turned away. In particular, there's one online service, the Telehippo, that seems to be doing this, but also people making phone calls. You can see what there is on the website, says birth year, but this message isn't getting across. Why the confusion, especially when the same thing happened when it was for 55 to 65-year-olds?
Well, I think the vaccination campaign is going extraordinarily well in BC. With respect to AstraZeneca, really, this is our second stream of a program. It's been distributed to 610 pharmacies, and there is sometimes difficulty around the edges, whether it's 55 or now 40. But in general, I think the pharmacies have done an excellent job in delivering the program. In addition, in hotspot areas, and we identified them, 10 of them are in Fraser Health, 2 of them Kensington and Squamish and Vancouver Coastal Health, and 1 of them in the Northern Health Authority in Dawson Creek. We have special immunization programs for AstraZeneca that are being run by health authorities. In our first day, we booked 17,000 appointments, and we're just getting started with that program. And so if there are problems, certainly I'd be happy to look into them. But these programs have been working exceptionally well. Yesterday, we immunized 42,300 British Columbians with their first dose of COVID-19, which is approximately 1% of the target population, bringing us close to 32% overall. We have used, at the end of each week, we use up virtually all of our Pfizer, virtually all of our Moderna, which is more consistent. And now we're making a very significant effort to use up all of the AstraZeneca we have. So I think the program's going well, and I urge people to be patient. But I think the pharmacies that have delivered this program on very short notice have done an excellent job, and if there are problems, I'll be happy to look into them.
Lisa, do you have a follow-up?
Well, I can tell you clearly that the problem is that some people think that people have to be 40 as of the date they're getting the vaccine instead of the year of, even though it says clearly on the website that it's year of. So that being what it is. Next question, regarding the availability of AstraZeneca, I know you just mentioned a number of places where they're doing the big clinics, but people who are living like on the Sunshine Coast are saying they haven't been able to get a shot at all. It looks like here in Victoria and some other areas there are no more doses. Will there be more coming like over this weekend, or is that it for now?
Lisa, why don't it might be helpful to you, first of all, and then I think I answered the AstraZeneca question in my first answer, but I'm happy to, I'll go over it again in detail. This coming week, just so we all understand, this week that we're in, we're receiving 138,060 doses of Pfizer. Next week, we're expecting to again receive, that's the week starting April 26th, 138,060 doses of Pfizer. Next week, we're also expecting 82,300 doses of Moderna, but that 82,300 doses, as we say, we've had more difficulty. That was expected to be more than twice as much. Starting the week of May 3rd, we're going to be receiving more Pfizer. For the following 4 weeks, it'll be at least 274,950 doses of Pfizer. We have the AstraZeneca we have for the moment. We're hopeful, and we hear it's possible the federal government may be able to procure more. So we're working through that. So there's two categories of AstraZeneca. There's the AstraZeneca that was distributed, approximately 170,000 doses through 610 pharmacies across BC. And people are eligible, and I hear the point you're making, 40 and above for that, based on their birth year, 40 and above for that AstraZeneca at pharmacies. And that amount, which has been out there now for some period of time, is getting less and less and was targeted, in any event, to communities with higher rates of transmission. With respect to our second program of AstraZeneca, that's focused on the 13 communities that were described by Dr. Henry on Monday. That includes Dawson Creek, Squamish, and Kensington, which is a community or a local community health area in Vancouver. And in addition to that, a number of Surrey, West and East Newton, Whalley, North Surrey, Guildford, Langley Town Centre, one in Abbotsford, and North Delta that are priority areas there. So for that program, it'll be those hotspot areas. For the pharmacy program, it's the 610 pharmacies. Once we're out of AstraZeneca at the moment, that will be it for this time. With respect to communities like the Sunshine Coast, let me say this, that communities that have relatively older populations, by definition, have received more in our age-based program, have received a higher share of immunization. So Vancouver Island, which hasn't benefited as much from the AstraZeneca program, has received more of the Pfizer and Moderna program because it has a relatively older population. That's also true of the Sunshine Coast and in Seychelles. In the Northwest, it's a little different. Some of our highest levels, we have about 16 local health areas in BC where more than 50% of people have been immunized. Largely and significantly, that's in the Northwest. Communities such as Kitimat and Prince Rupert, communities such as Fort St. James and others, which have had a high level of immunization because of higher levels of Indigenous populations and so on. Right now, we're focused, for example, on the Peace River and Dawson Creek. So overall, these issues tend to even out across, and most health authorities or most local health areas have very similar levels of immunizations right now, and that's what we see across the board. So with respect to AstraZeneca, we have one program in pharmacies. The vaccines are out there, and when they're done, we won't have more until we get more AstraZeneca. There's a second program, which is the second AstraZeneca program that's focused on the 13 communities I've described, and we are contacting people and making a very significant number of appointments.
And the final question goes to Rob Shaw, Czech.
Oh, hi, Minister. If you're a first responder in BC right now and you're still wondering as you watch 40-year-olds going to pharmacies getting their shot and you may be waiting, what will you say to them about when they are getting their shot and what they should be thinking about where they are in the rollout right now?
So in our age-based campaign, the focus is on people by age, and that age-based campaign is going very well. In addition to that, there are over 200,000 people defined as clinically vulnerable in BC, and they're eligible now, and a very significant majority of that group have received their immunization. With respect to first responders in some communities, such as Surrey, and other communities where we've taken an all-of-community approach, of course, they've already received their vaccine. We are taking a share of, Dr. Henry described as approximately 10% of our Pfizer and Moderna, and dedicating it towards specific workplace groups who are particularly vulnerable to COVID-19. On that list are clearly first responders and people who work in education, amongst others. So that's continuing. It was interrupted, as you know, by the change in use of AstraZeneca about, it feels like a long time ago. It was about a few weeks ago. And so we're moving ahead, though, but more slowly to target particular work groups, and first responders are amongst the highest priorities there. So we think it's important to protect our first responders, and that's why they're right at the top of the list.
That's all the minister has time for today. Thank you, everyone, for joining.
Thank you.